My name is Michael Rubino.
I'm on a personal mission to make sure you don't get sick inside your own home.
I knew there was something wrong. I'm just so relieved there's something that you can do about it.
Today's guest, I'm very excited to talk to. Ariana, thank you so much for taking the time to be here with us today out of your busy day for all the amazing work that you're doing. And I'm excited to have you and kind of dive into what exactly that work is. So let everybody know why you're here and what you're excited to talk about today.
Thank you, Michael. Also a big fan of what you've built in the ecosystem, raising awareness for folks around what could be a mold-related health issue. So thank you so much for that and for having me on the podcast today. So hi, everyone, founder and CEO of MoldCo. We're a venture-backed company focused on health-related services for mold-related illness patients, mainly providing care through our mold-certified provider network, prescription treatments, and advanced lab panels, just so you can identify the health impacts related to mold in your environment. And it was born out of a personal health journey that I went through actually in my Miami-based apartment. So it's quite personal to me, and I'm excited to be offering this to just so many more people, just to be able to navigate what was a very complex and frustrating and also expensive journey, just getting back to health.
Yeah, so if you don't mind, I think sharing a little bit about your personal journey and kind of what led to this point. Obviously, you saw a major issue within, just go navigating this and trying to get the treatment and stuff to get better. And obviously, you saw these different pain points that you wanted to help solve and create MoldCo. So, like what was that process like? Where did you have these aha moments? And ultimately, like how is MoldCo going to help solve some of those pain points?
Oh my gosh. Yeah, it's such a big question. I have a rolling now 80-page plus document with all of my epiphanies through the process. But I'd say one of the most challenging things for patients is just getting out of their mold environment. And I think renters actually have a lot more optionality for that. So one of the epiphanies there was, there's a 7-day cure notice available and a break lease notice available to just get out of the current lease situation and find clean housing. But then there's the problem of, okay, well, how do I know the next home that I go to is actually clean? For that, there's options like the dust test, like we were just chatting about beforehand, but then there's the delay in actually getting the results and the time to put in a bid for that. So like that's also a problem that hasn't been addressed yet. And then it's, okay, well, how do I make the most of my environment while I'm still in the mold environment? In the path to recovery. And for that, we looked at the whole scope of different air purifying solutions, which is just a Band-Aid solution. Like you should try to get out, but it does improve what's going on. And after the environmental piece, I'm summarizing like several months of epiphanies really quickly. There's the healthcare piece. It's like, okay, well, there's so many different philosophies out there. What was actually evidence-based? What was maybe over-engineered for mold-related illness, or what was purely anecdotal versus not? And that's where our company has spent the most amount of time to date. It's really sifting through hundreds of publications, getting in touch with world experts, reviewing their work, obtaining unpublished works, reviewing patient history forms, building a biobank, and really trying to suss out what's truth versus not, and providing these solutions direct to patients at a affordable and digital format. So there's just so many epiphanies to share, but getting out of the environment is important. And from there, it's having the right care that's also safe and effective.
So, I mean, one of the things that sounds like to me, this trying to figure out what's truth versus not. Obviously there are many doctors out there. Not all of them actually even are aware that, their mold illness exists, right? And then you have the doctors that do, and then if you talk to them, everyone's got their own kind of view as to, how a patient should be treated. Obviously that can cause a lot of confusion, right? Especially if you're someone who is not feeling well and you're just desperately trying to get better, right? So can you kind of go through how you've been able to kind of decipher the fact from fiction there, and how MoldCo is helping to address that for people so that they can rely on MoldCo to get better? And obviously, something I know that other people listening might not know is MoldCo is obviously kind of doing a rollout here, and it's available in some locations and stuff like that. And so You can definitely explain a little bit about that, so people who are listening can get access to MoldCo.
Yeah, absolutely. So on that last point, we're currently live in Texas and Florida in a closed early bird program. So to sign up for that, you can ping us at support@moldco.com. So support@moldco.com is the email. And I read all of those emails as well as our care navigation team. And then for sifting out what was truth versus not, I think maybe a better way to describe that is what do we have evidence for versus what we don't yet have evidence for. This is a newer field in medicine, and right now we're relying on very limited research, even though it is compelling research from what we've seen. It is smaller patient studies. It's been constrained to a smaller group of clinician researchers. It hasn't been well addressed at all in academia, biotech, or pharma. So we're essentially bootstrapping the R&D and clinical insights of an entirely new field is what it feels like. And I know that sounds very ambitious, but so far we looked at what has been published versus not, what data is available versus not, and then meeting directly with patients and clinicians, and even anecdotal evidence we were taking quite seriously. And for our platform, we relied more heavily on where were there actually symptoms improvement, where were there biomarkers improvement, were there controls implemented, how well defined were those studies, were the studies conducted appropriately, where are the gaps in our understanding. For example, there's some gaps around how the medications in this field actually work. Like there's a lot of really compelling hypotheses, but the mechanism of action hasn't really been that well defined. And what has been the remission rates too, so the level of success. And for that, it's been some of that's been published, some of that has been unpublished, and we've been working directly with the clinicians that have amassed this research and shared that with us. So we are going through as a third party, reviewing everything, and then also we have our own studies planned within the company. So that's just at a high level what we've done to just sift that out. And as a company, after that level of research, we landed on the Shoemaker protocol as being the most evidence-based solution. And not to knock other protocols or approaches, we just haven't yet seen the evidence yet to get behind those solutions. Like we do think there could be merit with some of the naturopathic solutions and ozone therapy even, but we just think there needs to be more grounded evidence there. And these solutions also don't necessarily lend itself to a telehealth format either, which is potentially where some of our clinic integrations can come into for aspects of care that need that in-person interaction, such as like ozone therapy, which does look promising, but we're not quite yet sold on that yet.
Fair enough. So it sounds like the Shoemaker protocol is something you're really leaning towards right now because of all the evidence there that points to its success. But also, just from a very high level perspective, I'm guessing you wouldn't call yourself MoldCo if we didn't believe that there was some validity to mold illness, right? And obviously, you've had a personal experience with this, but it's 2025. I still find myself arguing with people about the impacts that mold could have in people's homes, and despite all the compelling evidence and science and medical journals and all of this, sometimes people still don't believe, for whatever reason. They come through with skepticism that mold that can produce particles, it can produce MVOCs, and it can produce toxins, of which we have so much research on how toxic those toxins are, right? People come to this conclusion that it's not significant. As a matter of fact, I literally had a conversation with a researcher just the other day, well-known neurotoxicologist, and I was completely dumbfounded when this person said that they didn't see mold as a big significant health issue. So here we are. I made it. I made it through. I still have my brain cells left, but the question begs, the research that you've done obviously is very compelling. The program you're putting together is very compelling. And just to be clear, you wouldn't be here if you didn't believe that mold has a significant impact to human health, and that there's something that can be done about it specifically.
Right. And just addressing the skepticism, there are published studies. There's a reason it's called inhalational Alzheimer's. Like, we are seeing symptoms across these patients after exposure. There are even re-exposure studies that show the biomarkers get dysregulated even further, the key ones that are tied to this biotoxin illness pathway. It's not just the mold species. As you know, there's a melange of these different microbes in your environment that can cause innate immune system dysregulation, leading to a state of chronic inflammation. I think there's a lot more to be mapped out. Like, there are gaps in the research, which makes sense, right? It's been heavily underfunded and overlooked for since the inception of the concept, but there are quite compelling studies so far, even if they're smaller patient studies. And there's quite a lot of patients that are suffering. Like, there's a direct correlation to them being in the environment and never having health issues prior, and then suddenly having the whole onset of health issues and symptoms and biomarker dysregulation that's been mapped in several of these other patients. So it's kind of surprising to me that there's skepticism there after having gone through the rabbit hole. But I think there's a lot of compelling publications already out there, even outside of the clinician researchers that we've been working with.
Yeah, I couldn't agree more. Of course.
Yeah. Yeah.
So, all right. So can you please give everybody a little bit about, kind of your background and some of your experience? It's very impressive, and I think it's very, very good to highlight at this stage.
Yeah. So as a patient, basically how to science my way out of the issues I was dealing with. So I felt completely failed by our medical system. I went to multiple primary care providers, immunologists, allergists, pulmonologists, neurologists to try to get answers here. And their diagnostic tools were actually not aligned with how to actually diagnose and identify the health impacts of mold and mold-related illness. So a lot of the lab panels and imaging or lab orders that I was assigned showed up normal. I did have lower ferritin, but it wasn't anemia, and there's no way that would be causing this degree of symptoms, which is multi-symptom, multi-system, from severe fatigue to brain fog to hair loss. I actually cut my hair quite short due to the degree of hair loss I was experiencing, to rapid weight gain despite no change in diet, to feeling winded, walking upstairs, which is really bizarre for me because I was doing like high intensity classes and hot yoga, and I was running stairs as like my warm up. So to have that contrasted to where I felt while in the environment and after the environment was just a very odd place to be. And when I got sick, I was running my own VC firm. So I built that from scratch as a solo GP. And I was investing in bio and health. So I came in actually quite skeptical too, similar to your neurotoxicology friend, that I'm like, wait, mold can cause health issues and I can end up like this. So it was a very surprising thing to have happened to me. And it was just making more and more sense. And when I had the lab panels done, they were pretty much all dysregulated and indicative of mold-related illness. And anyway, that just opened the floodgates there. And prior to that, was a deep tech investor and worked as a chemical engineer across a variety of different larger companies and smaller companies, so including like early stage startups. So yeah, came from this more technical background and both on the operational and investing side, and actually came in not really knowing the impacts of mold and health, and just started learning and had a deep desire to help other patients that have gone through this, where they could be losing almost all their things, relocating, their relationships are suffering just because they're not able to show up fully. Like, there was a point where I was basically a hermit and completely withdrawn from the outside world because I felt embarrassed by my symptoms. I had changes to my mood. Like, it was very hard to relate to people during this time. And also the lack of like empathy as well, that I was facing these health issues and the medical gaslighting, which is like a whole other subject, which surprises me if you have a patient coming to you with real symptoms that are physical, right? Like the hair loss and weight gain are actual physical signs beyond brain fog, which is more internal and hard to discern. So it was just, the whole thing was pretty surprising. And the reactions were surprising too.
How about like some of the support? Did you? We talked about medical gaslighting. Some of the embarrassment of what you're dealing with and the skepticism. There's a lot to process there, obviously.
Yeah.
But did you have support as you went through this? I mean, or did other people meet that same skepticism, and was it difficult? I mean, for me, I just like I feel like I can't wait for the day where you can go out and be like, sorry guys, I'm just dealing with a little bit of mold, and everyone's like, oh, I understand. But right now it's like the lack of support, it makes it 10 times more isolating.
I felt pretty isolated in the beginning. I actually felt like I lost friends during this process, and I actually had a lot of pushback from my peers on the venture startup side to leave what I was doing and start a company. Like I almost felt like they were going to start an intervention. I was getting multiple texts saying, "Don't do this. You have, you could just keep building the firm. Like, do you really want to introduce this to your reputation?" Like there was a lot of fear and uncertainty and doubt and judgment coming from my peer group. But then on the other end too, there were folks that had gone through that as well, which gave me hope and also indicated that, hey, there could be opportunity here to help others. And I also had friends that were empathetic and supportive. And one of my friends actually worked at a clinic and had seen multiple of similar cases. And she tipped me off that, hey, it could be mold in your home. So if it wasn't for that, I don't think I would have made the connection, and I probably would have been sick still today, because it turns out I do also have a genetic susceptibility, which is part of the research that that's emerging and our clinicians have done that shows that even if I'm out of the environment, I'm probably not going to be able to effectively detox from the toxin accumulation that happened while there and stay in an inflamed state. And I think that's also true, because now I'm still taking medications on pretty much a daily basis just to keep the symptoms at bay. And I travel a lot, so there's always opportunity for re-exposure in hotels and airports and conference rooms and et cetera. So yeah, it's been an interesting journey, but in the beginning, a very mixed bag. And now I'm having less and less skepticism as there's more and more awareness. There's been, like, as you know, mover from the content creators and in Hollywood with HBO and Netflix shows emphasizing that mold causes health issues. So
Yeah.
I think the tides are turning, and that's actually been happening in the last year or so, and not so much before then, where we're seeing this pretty significant ramp up in content and awareness.
Well, I'm super grateful that things happen the way they happen. Not obviously you getting sick, but through that process of realizing that it was mold that was making you sick, and honestly, the amount of pressure that you probably felt from your peers and stuff to give up and just stick with what you had. I mean, I'm sure that pressure was very real, and pretty much you basically said, you know what, I'm jumping all in on this. And not only am I going to be grateful, but I'm pretty sure everybody listening to this right now is grateful, because what you're building is really exceptional. And we talked a little bit offline about the program you're putting together that I'm really excited about. I mean, we need to talk about one of the biggest issues with this, and that's accessibility, right? And it's if you could afford to remediate, you still have to be able to afford to go to the doctor right now, and the doctors aren't cheap, and the remediation isn't cheap. And I think the accessibility is something that I have been desperately trying myself to help figure out, which the dust test is one of those vehicles of doing so, right? Getting the data that you need at a more cost-effective approach than bringing an entire inspection team to your home and stuff like that. And we've got a lot of work to do. I mean, the Change the Air Foundation and everything we're doing there to help change laws to protect people, so that landlords are ensuring spaces are safe, and our government assistance buildings need to be safe. I mean, I bet neither of us would be happy to walk around a Section 8 building right now, but yet these assistance programs are important. However, they're not helpful if these are sick buildings, right? And so I think there's a lot to figure out on that side of things, but I think it sounds like you are trying to figure out some things as well on the medical side, which is really encouraging, right? We know there's an ICD-10 code from the World Health Organization. How can we get that to translate over into American healthcare? I'm sure you have some ideas, so I'll let you take it away.
Yeah, there's so much to comment on. And just on the point of accessibility, we're integrating with Christian Medical Ministries based in Fort Myers, Florida. So that's Dr. Alan Gruding's clinic. So that offers free medical services and free medication to low-income patients. There are some income requirements and a verification process involved with that, but that integration is happening pretty soon, which we're really excited about, to use our platform to be able to treat so many more patients at scale now that we're live in Florida and Texas. On the insurance coverage piece, yeah, there does need to be a lot more work. What we're looking now at internally is a way to collect more data, which could look like, what are your current monthly medical bill spending? What is that rough budget for you today? And how has that changed after MoldCo, just to create a compelling case for payers to then pay more attention to this, because it is about the economics and if it makes sense for coverage. I have met some providers that were able to cover the labs through certain CPT codes and insurance coverage too. So we'll be looking into that later on. For now, what we've done is work with our pharmacies and LabCorp to get the lowest rate possible for patients across the medication and the labs. And just by having a digital platform and our own providers on the platform, we were able to lower the operational costs quite significantly versus clinics too. So we've been trying to, in the near term, getting the self-pay price as low as possible. Right now, the average monthly spend, like all in, like basic lab panels, direct to consumer delivered prescription medications and the orders and the interpretation of the labs and the asynchronous messaging. So messaging your provider and support on the platform and the onboarding. So all of that included in monthly check-ins is on average like $200 to $400 per month, which is quite a bit cheaper than current clinics and offerings, which are, we've seen in the thousands, tens of thousands plus for care. So that's where we're at today. And over time, it'd be great to then get insurance coverage and like economies of scale to get that even lower and integrating with these clinics. So that's where we're at. We have explored insurance coverage, but it just hasn't really made sense for us yet until we have more data available to present to payers and to show the case that it should be covered.
Absolutely, and I think obviously, getting costs in a reasonable, like you've already achieved, getting costs to become reasonable for the average treatment, I think is going to help, make the case for insurance coverage as well.
Yeah.
On top of the other side of things, I mean, it's like, what's the cost of ignoring this, and how much are we spending in healthcare costs ignoring this, whether it's coded, whether it's coded properly or not. And I think that's the other side of things to explore, where you really could make the argument, because I mean, just looking at like the asthma alone, right? If you look at 22% of all asthma cases being caused by mold, and you look at the costs that has, talking tens of billions of dollars on the U.S. healthcare system, right? And so, how can we kind of reinvest our focus and lessen the burden there? I think, by being aware of it, by being able to, diagnose these issues faster and be able to, improve the environment and get the care you need, I think is really how this gets addressed. And, unfortunately, because we have all this skepticism from, academia and toxicologists and different people and very well educated, credentialed people, it makes things a little more difficult, right? Because now the awareness isn't there, because people are, kind of bringing out conflicting evidence. Well, if we have that, right, then we don't have the government looking into full-scale solutions, because they don't realize that this is such a huge problem that requires full-scale solutions. I mean, how hard would it be to start appropriating funds towards a lot of this research that we need, and being able to apply for government grants to be able to conduct more of this research? We don't have the big pharma money behind us, right? It's unless they're developing a mold pill, there's nobody that's sitting on the other end to benefit from any of these studies, right? And so a lot of the studies are conducted by researchers. And it's just the funding just it isn't there, but it needs to be there. We saw a lot of movement in the right direction after COVID, right? Because obviously people understood air transmission is important. We need to study air quality a bit more. And so we're seeing some of the benefits of that, but it still hasn't been dialed in the way you're looking to dial things in. And so it's frustrating to say the least when we see so many people impacted on a daily basis. But I wanted to kind of point that out, let you comment on it, and just thank you again for everything you're doing.
Yeah, thank you. I think we are moving in the right direction. The new administration, I've seen just content online around there being an emphasis around the environmental, like built environment and the health impacts of that, and even direct call outs to mold specifically. So that gives me hope. We also saw the ARPA-H Breathe grant. I'm not sure where that stands today, but that was entirely focused on the built environment and health impacts there too. So it seems to be there's at least something there to keep growing the research funding. For us, naturally, we do have constraints of how far we can go in that direction. So what we're doing today as a company is that we have these 5,000 or so human samples in our biobank. We'll be doing sequencing of that just to better understand the illness. We're looking into in silico, so using software to screen several different compounds and understand what's happening even further, and maybe could there be more effective and safer medications available, also generic and available today, versus going through the long FDA pathway to find a new chemical to address this issue. So that's an interesting research focus for us. But we have such a long list of these different studies and experiments that we are hoping to get looked at. And as an organization, to be spreading ourselves too thin to tackle it all on top of building the healthcare platform. So yeah, I'm really hoping there's going to be more researchers in this field and more entrepreneurs too, especially on the access side and the environmental side. Something I've been planting in a few people's minds is, hey, the cost of remediation is so high, like on the low end, I mean, you'd know these numbers much better than me, but on the low end, I think 4,000, on the high end, 20,000 plus. So are there micro loans available to help fund these projects for people so that they can get in a safe environment ASAP? And of course, there's also the QC quality control involved in that, right? Because not all remediators are created equal. You could be missing some important hidden mold behind the walls or in the crawl space or the HVAC system or behind the chimney, et cetera. Like it can be hiding in all these different places. So what's a very comprehensive way to address that problem and also cover the financial piece of it? So there's just so many problems across the scale within this space, and it's overwhelming. So I'm really hoping more research, more entrepreneurs, more media attention towards this issue, because it very well, I mean, this is our stance that this is now a public health crisis and at the root cause of many of these issues that are now missed and misdiagnosed by our healthcare system, or just characterized as a mental health issue, right? With the medical gaslighting, like, oh, well, why don't you go to a psych ward because your symptoms aren't real? Like,
right.
Very surprising result, especially for these patients that have never had a history of mental illness before. It's a surprise.
Especially considering, some of these mycotoxins are literally classified as neurotoxins, right? Especially with the amazing, compelling research we have out there on some of the neurodegenerative diseases that can be caused by some of these toxins. And so, yeah, it's pretty alarming. I think, we see a lot of anxiety and depression and mental health issues come out of being in these water damaged buildings and being exposed to, different contaminants that come out of that, especially MVOCs, the spores, the toxins. There's a lot that goes into it, right? You have bacteria that starts to grow. If you have mold, you're going to have bacteria too, right? You have those toxins to worry about. And so, it's a bit alarming. There's a lot there to uncover, but we know for sure if you are addressing these issues in the environment and you are removing these issues from the body, you're seeing people get better, right? It's not even up for debate. I mean, we're seeing this in real time. Like people are getting better. I mean, I could point to thousands of different cases I know of, right? And I'm sure you know of. And you start to ask around, it's like everybody's seen this, right? You get out of mold and you start to recover, right? And you see a doctor, you start to feel better. I mean, it's so, I don't know why we have these issues, and why we're seeing this skepticism on this public health crisis. But I guess it's part of the harsh reality that we have to deal with. Because, I mean, I've been screaming this from the mountaintops for about 13 years now. I definitely see more reception today than ever before. More people are aware of this than ever before. So super grateful for that, right? Because it's helping people discover the problem faster, right? It's helping people get out of the mold faster, right? Start to get treatment faster, right? So the average span of people's exposure is shortening, which is good because people are more aware of it, and they're more open to that idea that, hey, there's something really, really small that you really can't see that you're breathing in. COVID obviously helped us understand that concept a little bit better. It's unfortunate that we have to kind of go through tragedies before we pick our head up off the pillow, but it's just part of our nature, I guess, sometimes. We're here. Things are exciting. Love what I'm seeing in some of the, some of the Make America Healthy kind of shift that we've seen. Definitely love some of that stuff, but it always pains me, when we're saying things like, it's really the kale and the Fruit Loops that we need to worry about. And I'm like, okay, but let's we breathe 20,000 breaths per day, and we inhale enough air to fill up a normal sized swimming pool. So let's not lose sight of the fact that air is super important and often kind of overlooked. And so, while I'm definitely excited to see where things are headed, because I think all good things, banning red dye 40 and, having these tough discussions around processed food, these are all really, really good things. I just hope that we don't get too lost into the weeds, and stay focused on the bigger picture. How do we make, large impacts, for a lot of people at once by looking at a lot of these different things? And let's not forget, breathing, which I think none of us can argue about how important that is, right? And so I think, let's not get lost on that concept, because I could see it getting lost pretty quickly. There's a lot of shiny objects out there to tackle.
Absolutely. I mean, the visual image that came to mind is being at a car accident scene and focusing on the quality of the tires versus what actually happened at the accident scene. Like, I think you're right. I think we're getting into these like long tail of micro optimizations, and we're missing the bigger point. Like, we spend so much time drinking the cleanest water possible, eating the freshest, most organic, et cetera, foods, and then completely overlooked is the air we're breathing in the environment we're in when we're spending roughly 90% of our time indoors. And my sister said something, and I think she borrowed it from an air purifier company, but if you don't have clean air, your lungs are now your air filter, right?
Yeah.
And that's going to be tied to what enters your bloodstream and then what gets transferred to your organs. So it's just, I think it's a shift in how people are thinking about it. In one of our first calls, I love what you said, where it's this concept of ignorance is bliss. Like, you almost rather not know what's in your environment, because it's almost such a shocking thing that if you've been inhaling these biotoxins and microbes for X number of months or years, and now you have a health issue, for that to come to terms with that concept, right? And what does that mean for your community and your friends and your family and financial spend? Like, it's almost easier to not know, at least, philosophically, but in reality, you have to know. Like, you have to know if you've been exposed, and you have to know if you're having health issues from that, and your family has to know, and your roommates have to know. So it's an important concept to overcome, and not have ego or denial with it.
Yeah. 100% right. So I know you mentioned a little bit about the program in Florida. Tell me a little bit about the program in Texas. Tell me about your grand plans for obviously making this a more widely used practice for people across the country. We talked offline before, and I love how you're really dedicated to doing this right and not taking on too much too fast, and making sure that you're able to provide quality care for everyone. And so, would love to just hear a little bit more about your plan, and we're going to get into where can people find you, how do people get involved and help supporting you, and all the amazing things that you're doing.
Yeah, amazing. So we're doing our closed beta right now. We're calling it our early bird program, where we're able to onboard a select number of patients. So it's a closed beta. We're really focused on delighting our first 100 patients. So that's our near-term goal. So we're just getting started on that last month. So it's January now. So we got started end of December, and we're finalizing our next cohort of patients at the moment. We're training new providers on our platform because it is a very specialized approach and they need training, and there is a limited talent pool available just because of how specialized this is. In fact, the current clinics that have this protocol often charge thousands or tens of thousands of dollars, and they have very long wait lists, or they've stopped taking patients altogether. So we actually have to train our providers from scratch, and doing that is Dr. Shoemaker himself. So he's partnered exclusively within our company. And also Dr. Scott McMahon, who's our medical director, and just a number of other providers in the network that are coming together and helping to expedite training for our providers. So that's more on the provider side. On the patient side, we have labs available today, prescription medications, the digital platform with the synchronous visits where you can meet your provider face-to-face on Zoom and also message them in the platform with any questions that come up. We have a resources hub with lots of frequently asked questions and content, just so you can better understand, what do your labs mean? What are these medications? What's the dosage? What can I expect? So all of that's included in our library of content. You can reach out to us at our email, which is support@moldco.com. I read all of those emails, and then from there, we will take you through our onboarding process, which includes a questionnaire. And the questionnaire has clear inclusion and exclusion criteria. So you'll know right away whether we can accept you or not. And if you pass the questionnaire, it's a pretty high probability that we'll accept you into the program. And from there, you meet with our provider and go through the steps of the treatment and protocol. And we've also been able to help a bit on the environmental side. It's not our core focus, but we mainly partner with external companies that we like and trust that are able to deliver on the environmental side too, because that's also a very important piece. And in fact, it's one of the most important pieces, is getting out of the environment and being in a clean and safe home. So yes, that's all included at the moment in Texas and Florida, and we got it as low price point as possible. And we're starting the process of ramping up in other states such as Georgia and New York, California, Massachusetts, et cetera. So we have a state-by-state rollout plan for this year as well.
That's awesome.
Yeah.
As a visionary person myself, please, share your vision with us. Tell us, we know how to get involved today. We know that we're in closed beta, but where do you see MoldCo going, and how will it integrate with our lives when we do need it?
Yeah, absolutely. So the parent company is actually called the MoldCo for a reason. And so MoldCo is our DBA, or doing business as, and that's our public facing brand and presence. But our goal is to continue to find the most evidence-based, safe and effective solutions across these immune system dysregulations and overlooked illnesses, underserved illnesses. So next up is actually tick-borne illnesses, and we've already started doing the diligence and laying the foundation for that too. So we'll have MoldCo, and then potentially LymeCo, which isn't really the right name for it because it should span all tick-borne illnesses. As you may know, Lyme has a very narrow definition for diagnostic criteria, and then LongCo for long COVID. So then we'll cover fungal species, which also include the bacterial species as well in your environment, bacteria under the tick-borne illnesses, and LymeCo, and then viral for long COVID. So we're covering the span of different microbial insults that impact the immune system and show up as a state of chronic inflammation. So that's the vision for the company. And our thesis is, how do we get solutions affordably to patients today? So we're mainly looking at these generic off-label prescriptions to be able to do that. And that's our current philosophy. now. That may shift in the future, but that's essentially what the shoemaker protocol is, and it seems to be working. So we'll just continue along that vein, and we don't have to wait 10 plus years and spend tens of millions of dollars developing a new therapeutic. Like, we can actually start treating patients nearer term. So that's exciting for us.
That is really exciting. I just want to, thank you again. Probably will thank you 100 times more. And I'm so glad to be connected with you. And please, anything that I can do to help support you, let me know. Obviously, this is an important endeavor, right? Just streamlining everything and having a platform like this where people can go that is committed to, trying to solve their problems at a lower cost, make things more accessible. That's something we desperately need. And thank you for noticing that gap, and trying to solve and fill that gap, because it's really, really important. And in this community, sometimes we tend to tear each other down. And what I want to do is I want to build you up. And so please, anything that any of us can do, because we're a tight knit community here. Everybody listening is going to be sharing this, no doubt. I mean, what you're doing is so freaking cool. So I just want to applaud you for that. And thank you again. And please, even after this episode, stay in touch, because we obviously need to support one another and make sure that the solutions are in place for people long after we're gone, right? Because this is a public health crisis, and it's not going away anytime soon, unfortunately.
Whoa, thank you. That's super kind of you. I really appreciate that. And I feel very honored to be in a place where I can give back to humanity in a place of service. So yeah, excited to be building this, and it's the most heart-centered and exciting thing I've done to date in my career. So it brings me a lot of joy to be able to do this. So yeah, thank you so much for the care and support. I really appreciate it.
Yeah, and this will be the first time you're on, but we know it won't be the last. That we can say sure of. Thank you so much, and we'll see you next time.
Thank you.